She checks her arms, her legs, runs her fingers through her hair, the way she always does after a hike. Nothing. She's clean. She's sure of it. She goes to sleep. That was the mistake. Not the hike. Not the trail. Not even the moment she brushed past that low branch of tall grass near the creek without looking down. The mistake was being sure. The Black Forest, on a June morning, looks exactly like safety. That's the problem. The light through the canopy, the well-marked path, the wooden signposts, the family up ahead with a dog. A man in his 50s walks just off the trail to photograph something. A mushroom, a patch of light on the forest floor. He steps into the grass for maybe 4 seconds. He doesn't feel anything. And that's not a small detail. That's the entire story. Because the thing that just found him was built, over millions of years, to make sure he doesn't. Germany has wolves again. 200 of them, spread across the country. And there are entire news cycles, political debates, livestock compensation programs, dedicated to managing the threat they represent. 200 animals, every one of them visible, every one of them loud, trackable, the kind of danger you can picture. Nobody is building a task force for what's actually in those forests. It doesn't have a silhouette, it doesn't make a sound, it weighs less than a drop of water. And it's in the grass right now, in every forest, every park, every suburban garden in the country, waiting, not for you specifically. It doesn't need to be specific, it just needs you to walk close enough. And this is the part no one sees coming. Because the bite isn't the dangerous part. It has a name. But the name isn't what matters. Because you've probably already walked past it. Before it feeds, it's smaller than a sesame seed. You wouldn't notice it if you tried. And that's exactly the point. It holds its front legs out and waits. Scientists call this questing, reaching toward the warmth of anything that passes. It can do this for months without food, without water, without moving. And that's not where it ends. It has no urgency, because it doesn't need urgency. But here's what doesn't make the nature documentaries. Before it even starts feeding, your body is already being told not to react, not to feel it, not to fight it, not to notice. The tick didn't stumble into being undetectable. It engineered it. 3 separate biological mechanisms working in sequence, all before you feel a thing. It's not hiding from you. It chemically influences your body's detection mechanisms to bypass initial notice. This sophisticated adaptation is crucial to its survival. The man gets home, he showers, he checks. He finds nothing, because the tick is behind his knee in a fold of skin the mirror doesn't reach, and it's still smaller than a freckle, and it's been there for 6 hours, and his body still has no idea. Meanwhile, something is moving through him that isn't him. And this is where it changes. What matters is what it does after it gets in. It doesn't stay, it spreads, quietly, into places your body can't easily fight it. Your joints, your nerves, sometimes even your heart. And by the time you feel something, it's already been there longer than you think. He won't feel it for weeks, maybe longer. And the window that exists right now, tonight, while it's still early, while the right antibiotics could stop this entire cascade before it starts, that window doesn't announce itself. It doesn't tell him it's open. It doesn't tell him when it closes. It just closes. And most people don't even realize it was open. Somewhere between 60 and 100,000 people in Germany are infected with Borrelia every year. And that number is only the part we can see. That number is almost certainly an undercount. Because Lyme disease is a condition often challenging to diagnose in European medicine. Not because it's exotic, because it doesn't look like itself. And this is where it gets harder to recognize. In one person it presents as joint pain, not constant pain, moving pain. The kind that settles in a knee for 10 days then appears in a shoulder. A doctor sees this and thinks arthritis. In another person it's facial palsy, one side of the face drooping, and a different doctor thinks Bell's palsy, viral. Treat it as such, wait for it to resolve. In another it's cognitive fog so specific that people who've experienced it describe it as thinking through wet concrete, every word slightly delayed, every memory slightly out of reach. That doctor considers stress, depression, burnout, and the test confirms nothing. And this is where everything breaks. Because what you think is happening isn't what's happening at all. Current standard Lyme disease blood tests may not detect between 30 and 50% of actual infections in the early stages. The bacteria are there, active, spreading. The test comes back negative, but this is where it gets worse. The patient gets sent home. And this is the part people miss. The man from the forest gets sent home, and the bacteria keep moving. Here's the part that rewrites everything you thought you understood about infection. Treat it early. It can stop everything. But early doesn't last long, and most people don't know when it's already gone. But early doesn't mean what people think it means. It doesn't mean you have time. It means you haven't missed it yet. There's a name for what comes after. Post-treatment Lyme disease syndrome. And this is where it doesn't end. People in Germany, in France, in the Netherlands, who have been symptomatic for years, not hospitalized, not visibly broken, just chronically, inexplicably unwell, joint pain that insurance forms can't quite capture, fatigue that doesn't respond to sleep, to exercise, to anything the guidelines recommend, cognitive symptoms that cost them careers, relationships, their previous sense of themselves. Some of them were told it was psychosomatic. Patients sometimes receive negative test results, which might lead to symptoms being attributed to other causes, when in fact, Lyme disease was present and either untreated, treated too late, or with insufficient dosage, or treated for too short a duration with a dose that wasn't sufficient for how far the bacteria had traveled. The tick had fed for 3 days and then dropped off on its own. The host never knew it was there, and years later, sitting in a doctor's office, being told that the blood work looks fine, being asked about stress levels, being handed a referral to a therapist, they still can't point to the moment, can't name the trail, the day, the exact blade of grass, because they didn't feel anything. That was the point. The Robert Koch Institute estimates that in certain regions of Germany, between 5 and 35% of ticks carry Borrelia. The range in that estimate isn't uncertainty, dressed up as data. It's genuine variance. The distribution is patchy, uneven. A cluster of infected ticks on one stretch of trail. Clean ticks 200 meters further on. No way to map it. No way to look at a forest path and make an informed risk assessment. You walk in, you guess, you check afterward, if you remember, in the right places, with the right light, within the right window of time. Most people don't get all of that right. Most people don't know they need to. The woman from the beginning, the one who checked and found nothing, finds something 4 days later, behind her knee, dark, slightly swollen, the tick fully fed now, and significantly larger than its initial size. Her husband removes it carefully, the right way. She books a doctor's appointment for the following week. The rash they're both watching for never comes. She doesn't know that in roughly 20 to 30% of cases, it doesn't. She starts feeling tired in July. But it's summer. It's hot. Work has been difficult. There are 100 explanations that make more sense than something she doesn't know to look for. The fatigue is still there in September. In October, she tells her doctor about joint pain. Nothing severe, just a dull ache in her right knee that moves sometimes to her lower back. The doctor orders blood work. Standard panel. Everything comes back within normal range. She goes home. The forest is still there. It was never the threat. The path, the light, the signposts, the family with the dog. None of that was the danger. The danger was at the exact edge, where the trail met the grass, in a space you pass through in a single step without looking down, because why would you look down? You've walked this path before. You know it's safe. The tick doesn't need you to make a mistake. That's what makes it different. It just needs you to walk. Tonight, in parks and gardens across Munich, Hamburg, Frankfurt, Cologne, in the grass at the edge of a suburban lawn, in the leaves a child played in this afternoon, in the unmowed strip along a bike path that cuts through a neighborhood in Stuttgart. In all of these places, Ixodes ricinus is doing what it always does, holding its legs out, waiting. It doesn't know you're coming. It doesn't need to know. It only needs you to get close enough, and you don't feel a thing. That's how it works.